What I want you to do now is experiment with the pressure. You'll be surprised, sometimes you can put through a lot of pressure, what might feel like too much to you as a therapist, but it's actually okay for the patient. So let's have a go with you, John. How's that feel? Harder still? Yeah. Brilliant. Now we can go to the other side, but you can also use the tool, take advantage of the indents there, so you can come across both sides at the same time and up the back. So when you try this, I'm confident you can do what I'm doing right now, but what I want you to do is to experiment with adding more pressure, getting the feedback from your client, from your partner, to ask them how much pressure you can put through and tolerate, because you'd be surprised, you can obviously put through sometimes put through a lot more than you thought you could. But that's pretty simple, it's straightforward, you could all do that. That's not enough, we need more. What I'm going to get you to do now, please, John, is come up into a stretch position. So come up onto all fours, and then if you're okay, drop back. That's great. Okay, so that's going to be your finish position. Get them up into this 4-point kneeling position. Set your tool in position, and then I want you to slowly drop down, please, into that yoga stretch, balasana stretch, or shell stretch as you glide over. You pretty much hold yourself in position and they do the movement. So it's an active stretch with the addition of that soft tissue massage over the top. Okay, you've got to educate your client to move in the way you want them to move slowly. And as you drop into that end of range, John, exhale, breathing out into end of range, relaxes the rib cage and helps you stretch a bit. That looked great. Let's do one more. How's that feeling?
Yeah, really good.
Hold that position there. Slowly into the child's pose. Take your time. Go as slow as you want to. A little bit gristly there as we pass over the lower back. That's quite normal. And then breathing out as you go into the end of range. All right, brilliant. So you can do more of those. If that feels good, do some more. But that's still not enough. So if you can sit facing this way with your back to people, please. Put a chair under your client's feet, or make sure their feet are in contact with the ground. Just shuffle forwards a little bit for me. Okay, so this flexion melt technique, start up in the mid-thoracic and slowly start to flex forward, starting with your head, letting your head drop down, letting your shoulders come forwards, and flexing forwards, bringing yourself between your knees as we come down over the lumbar spine. Brilliant. Come back up. I'm going to be a bit more targeted now on one side, starting a little bit lower and dropping when you're ready. Slowly flexing forwards. Maintain that pressure into the lumbar spine, coming down like so. One more. Great. Maintain that pressure. Okay, vary the angle a bit if we want to. So coming into QL and the top of the glutes, I'm going to get you to flex, but a little bit more over to your right side. So that's techniques for flexion. We can also look at techniques for side flexion. First one, arm up and over. That's great. Coming back. Drop in off the ribs, lock in over the side of the torso there into the QL region, and then let them side flex away as you glide the tool down inferiorly. Okay. And again. Okay, that also works nicely on the side. So drag the soft tissue down, lock into position, and then stretch your arm up and over. Brilliant. We can go the other way. So relax the arm. And this time, you're going to take the leg back and drop the leg off the back of the couch. Okay, when you're ready. So we've dealt with flexion, side flexions, now rotation. Just going to switch tool for some variety. So you have that bottom leg straight, top leg bent up. Hold your forearms like so. So this is a classic lumbar rotation setup position, and we can do that for the lumbar spine. We can also instead consider more of the soft tissue. So thinking about the line of strain coming contralaterally across the back, glide over the soft tissue each side of the spine. Using the broader part or the narrower part of the tool.